Hello and good morning. My name is Lydel Wright, and I'm a registered nurse, a healthcare leader, and an innovator. And it is my pleasure today to introduce you to the Access Gown. In this presentation, I will share details about the Access Gown and some of its features. I would be remiss, however, if I didn't share our most important detail or feature, which is how we plan to leverage the Access Gown to not only create early opportunities for certification or licensure in healthcare and tech, but also to improve health equity through access. Today's hospital gown adds nothing and often takes away from the patient experience in the healthcare setting. Historians note that the current hospital gown often seen in healthcare is more than 100 years old. Yes, 100 years old, dating it back to a time where dignity and thoughtfulness around patient care came second, third, or maybe fourth to discovery. Can you imagine anything else so customer-facing in healthcare going 100 years without significant innovation? That's like clinicians tasting urine for sweetness to diagnose diabetes in 2022. Count me out. But the pain associated with our experiences often birth the greatest innovations. After my next slide, I will introduce you to the pain, problem, process, and promise that led me to pivoting and creating the Access Gown for dignified fashion, form, and function in healthcare attire. But before we go into that, I'd like to start with gratitude. I am eternally grateful that a young Black man can get a shot in a profession that's predominantly led by white females or white males in general leadership to both ideate, challenge, produce, stretch, and grow as a contributor. I cannot say enough about how grateful I am to have such an amazing family of J&J Nurse Innovation Fellows and leaders that believe in what you're producing, challenge you to think about it in different ways, and talk you through your losses and celebrate your wins along the way. Special thank you to everyone involved, Lynn and the CCL team, Danny, her cat, Picasso, Katie, and everyone at APCO, Noah, my personal coach and cheerleader, Rebecca and Nancy at Nurse Approved, Michelle Morgan, and the Linda Benton at Johnson & Johnson, who are some of the fiercest advocates in healthcare innovation. And to all the guests here this morning, thank you for taking your time out to be here with us. In this photo is my best friend of more than 12 years. He was in a tragic accident that caused him to have a traumatic brain injury requiring a craniotomy. I had dealt with patients for more than 14 years by this time, but my knees buckled when I heard that my best friend may never talk, may never walk, may never be able to be his complete and electric self again. I was determined to see him through this difficult phase and stayed at his bedside for about 2.5 months of his recovery. To relieve pressure off of the tax nurses, this is in the midst of COVID, of course, going on, I took on a lot of his care tasks, but throughout the care delivery, I found the gown to be obstructive to his care. Hence, the Access Gown was born at his bedside with a pencil and a notebook. So let's talk about the problem. Research has consistently shown that patients are vulnerable to dehumanization and loss of identity in the hospital, often exacerbated by wearing the standard gown. A mixed method study revealed that hospital gowns may lead to an increased sense of exposure, discomfort, disempowerment, and embarrassment for patients during a vulnerable time where they are seeking medical intervention. Do no harm, right? Imagine during the most vulnerable time in your life, someone puts you in one of these. Hospital attire is inadequately designed, ignoring the accessibility needs of patients and staff, leading to increased dissatisfaction and staff burden. Instead of comfort, today's gowns leave the patient exposed. Some of the newer options provide more coverage, but are also more obstructive to care. It's time that the gown be more than just clothing. It's a functional part of caregiving and essential to delivering dignified care. So let's talk about the problem by the stakeholder. It's common knowledge that hospital gowns are flawed, yet very little is done to change this. The current gown literally presents no value to any of the stakeholders, and that's ironic in value-based care. Patients are left exposed all in the name of access. Team members have to fumble, move, and search for access. Organizations appear to lack innovation and empathy for the patient experience while taking on excessive costs due to patients wearing 2 or more gowns. Not to mention the micro impacts of staff productivity that collectively result in macro financial productivity and staff satisfaction or joy impact. So let's talk about the solution. The Access gown was developed with a focus on dignified fashion, form, and function. In the area of fashion, we leverage bold designs that promote self-image and autonomy through a reversible gown that offers the client a choice in which side they want to wear and when. The patterns also allow for variability in design, which helps to give a feeling of individuality. In the area of dignified form, the Access gown allows for a better client fit due to the internal and external side tying mechanisms, reducing the frumpy feel and look of gowns. And in the area of dignified function, which is displayed in our innovative access panels and access ports. These access spaces were specifically designed with the patient dignity in mind, but also staff and patient self-accessibility. We didn't stop there, as we wanted to make sure our gown had environmentally functional features by decreasing the amount of necessary laundering and water consumption. You will also see that we have created the first and only hospital gown known with the intention of expression through patients being able to color on the gown. This not only extends the use of the gown into therapeutic mental health expressionism, but can also have a functional impact, as coloring is known for its fine and gross motor improvements and impact. So let's take a brief look at our adult premium and ultra premium gown in practice. Our portfolio of gown designs consists of a children's animal print design, as well as an adult ultra premium style that is more like a robe, and then a Kendra Scott design version of the gown as well. Our gowns bring a cadre of features that transform and bring value to the gown. Leveraging premium materials and superior quality, our gowns results in dramatically improved longevity and durability. We will leverage volume to control costs for organizations. For the institutions that leverage laundered services and pay by the pound, the financial use case is clear as well. Hospitals pay for laundry service by the pound to wash and produce linen. By examining the weight of our premium gown, which is 0.9 ounces, and the standard gown, which is 0.8 ounces per gown, you can quickly determine that the patients wearing 2 gowns results in a 0.16 ounce weight, which is an increased cost to the organization. Multiply that by the number of hospitalizations a year, and the impact adds up. To date, we have been able to negotiate and foster a relationship with Kendra Scott brand, who co-developed the yellow children's gown option. Also been able to acquire an exclusive license to leverage the American artist Charley Harper's Wild Safari for our children's coloring gown. Advance to the next, please. Upcoming, we are excited to share that we are finalizing a relationship with the Joshua Leonard Stewart Studios, a Black illustrator who created the animated series Team Supreme, which features a crime-fighting group of special needs kids whose disabilities double as their superpowers. We are also in early discussions to leverage our ultra-premium product as a direct-to-consumer offering for postpartum mothers and post-surgical patients at home. Please advance to the mission. As noted early in this presentation, our most important impact is with the sale of each gown. We will donate a percentage of each gown sale to creating early high-wage paying opportunities for socioeconomically disadvantaged communities through providing access to healthcare and technological certifications and licensure. Advance, please. Thank you for your time today. And my ask is that you will see a place for the Access gown in your organization or health system and collaborate with us to create dignified access for your patients, clinicians, and communities. Thank you. Noah, turning it back to you.
Yeah, terrific. So there's a question from Dr. Ray Charles, who has a phenomenal name, by the way. He's asking, he's telling you it's amazing that the Access gown can and will increase psychological safety. Has your research shown a relationship between the use of the Access gown, psychological safety, and patient engagement?
So we're in the early stages as we're pre-launch. So we are taking a look at that data, trying to get some studies done within some of the organizations to help really validate our claims. But at the same breath, we know that the current data that is out there today tells us that the current hospital gown does result in leaving the client feeling very vulnerable, having them feel very depressed sometimes, and doesn't add any value to the patient's experience. So our goal is that we've taken a lot of the research that's out there already in regards to coloring, in regards to design, in regards to how thermodynamics and keeping thermoregulation, and we created our gown leveraging those type of features all in one. Hopefully that answers your question.
Thanks for addressing that. I think that there's another question regarding patenting and just wanting some clarity on what you've done to patent your designs and the challenges around that.
Absolutely. So we have a provisional patent. There are some challenges in these type of patents in regards to design patents. Things can change. If you change a little bit, it sort of upends the market. But we do have a design patent that we have applied for at this time, and we're hopeful that we'll receive it for this gown.
Nathaniel Rosenberg has another question for you regarding have you considered access clips, a spot clip to drains on the gown so they don't hang? Currently they're using safety pins.
Spot clip for where, I'm sorry?
On the gown so that they don't hang. He says they're currently using safety pins.
Yes. So actually, one of the features in the gown, which we didn't get to show you, is that there are a number of hooks included on the inner portions of the gown, especially there's a leg slit that allows you to hang your Foley catheter bag from it so that you can walk with it, as well as there's also ones for your G-tube at the top as well to kind of hold up your lines at the top access panel as well. Couldn't show you everything today.
So I'm wondering if you can speak a little bit to Lydel, just finally, before we move on to bringing everyone back in these last 10 minutes here, just regarding the cost and how you're moving this forward with the unit costs.
For sure. So for organizations that purchase gowns outright, we look to continue to make it a volume game. So we know that the more that is purchased or the more that is created at one period of time allows us to scale and keep costs low. So that's going to be our pathway for organizations that outright purchase gowns. I sort of alluded to it in my conversation a little bit earlier. For the ones that launder gowns, they normally pay by the pound. And again, the use case is there, the financial use case is there in that we are more lightweight. We don't use metal snaps, we use plastic snaps. That allows us to leverage the gown in radiology suites and in other places as well. The wraparound of our gown helps you, thermo regulate, as well as it just provides more of a security for the patient, so that the patient just feels more secure. So with all of those features, we just know that that the gown will produce remarkable savings for the organization, but also bring great patient satisfaction, and that's what the goal is.